Hi. Just one moment, please. I'll be right with you.
Sorry.
How may I help you?
I need to talk to someone. I had unprotected sex.
Okay, if you would just like to fill this out on the tablet, fill out your information, and a nurse will be right with you.
Thank you.
You're welcome. Abby, I just want to. Hey Abby, so what brings you in here today?
About a week and a half ago, I had unprotected sex.
Okay, so you had unprotected sex. Let's talk about that. Did you use any form of birth control at all?
No, I'm not on birth control.
So what are your concerns regarding unprotected sex? What would you like to talk about specifically?
I heard that he has HPV, which is a cancer.
So HPV is a common STD that people can get from having unprotected sex. And most of the time, it doesn't lead to cancer. Sometimes it can go away on its own. But it does increase your risk of getting cervical cancer. Here at Planned Parenthood, we can offer some testing. So we can do what's called a pap smear, where we do have you ever been to a gynecologist before?
No.
Do you know what a gynecological exam is?
No.
So what we do is we can either do it here or you can do it at your provider's office. And what we would do is you would go on a table, we would put a Q-tip, it's kind of like a Q-tip, on your cervix, and we would just swab, kind of like we would if you had strep throat, and we would see if there's any abnormal cells. So that would mean that you might have cervical cancer, but HPV doesn't always lead to it. We can also give you an HPV vaccine here, which protects against 9 strains of the HPV virus.
Okay, that makes more sense. Do you look for any other STDs? I don't want my parents to find out.
We do, so we can screen for other STDs such as genital warts, gonorrhea, hepatitis, A and B, herpes, syphilis, things like that. And as far as your parents, they don't need to find out. We can do confidential testing here, just get you the answers you need and get us one step further.
Okay.
So you seem like you might have more questions. I'm happy to talk to you about any of your concerns.
Yeah, I had never really learned about birth control or anything, so I really don't know if I'm pregnant or if I have an STD.
Okay, well we can do a urine test here if you'd like, and we can screen for both STDs and pregnancy. Would you be interested in that?
Yeah, that sounds good. I would feel better if I knew for sure.
Great, we can do that after we talk. When was your last period?
About a month and a half ago.
And how often do you normally get your period?
I should have gotten it a few days ago.
Well, your period can be late for a number of different reasons. Stress or anxiety can cause you to have a late or missed period as well. It's not always due to pregnancy.
I guess I have been really stressed lately. My finals are this week and I haven't slept very well. Plus I've been nervous about all these things and I haven't been able to talk to anyone about it.
Well, Abby, this is a safe space and I'm happy that you feel comfortable talking to me. What you're going through is stressful and it's okay to be nervous. Your feelings are valid.
Thank you. I was really nervous to come in and talk about it, but I feel better knowing more about these things. Could we talk about different kinds of birth control? I want to make sure I have control over my sex life.
There are many kinds of birth control and I'll give you a pamphlet as I talk about them. The type a person uses is completely up to them and what they're comfortable with. There's both hormonal birth control and non-hormonal. Would you like to talk about both?
Yes, please.
Okay. The most reliable kind of birth control is abstinence, which means not having any sex at all. Another kind of non-hormonal birth control are things like condoms, male and female. You can use spermicide, which helps interrupt the movement of the sperm, and you can use withdrawal. Withdrawal is not a very reliable method because all it means is that you're not using any other kinds of birth control and you're just relying on the male to withdraw before he ejaculates. Hormonal methods of birth control are things like the birth control pill, the patch, the injections, the implants, and IUDs. Would you like to talk in depth about any of these options?
I've heard about the birth control pills before, but I'm not good at remembering to take medicine every day. What reliable options could I use?
So if you want to go with hormonal birth control, reliable options that you wouldn't have to take every day would be things like the patch, where you stick on you every week, and then you have 1 week off. You could use the injections, which are injected into muscle every 3 months. You can use things like the implant, which are put in your subcutaneous tissue in your arm, and that can stay for up to 3 to 5 years. And things like the IUD, which can stay in place in your uterus between 3 years and 12 years, depending on which option you pick.
I think I'd like to try the birth control implant.
Perfect. So we can make an appointment for you to get the implant placed here. And it works by releasing a hormone called progesterone that goes in your arm, and it can help prevent pregnancy. You still probably want to use a method of birth control such as condoms that can help protect against STDs if you're not with a monogamous partner.
That sounds good. How long does it stay in?
It can stay in place for up to 5 years, and at the end of those 5 years, you can have another implant put in its place if you so choose.
Sweet.
All right, Abby, do you feel ready to try the urine test?
I guess so. I just want to know.
Okay, I can grab you a cup.
Thank you.
You're just gonna bring the cup into the bathroom and pee into it, and after that we can do a pregnancy test on the urine as well as tests for gonorrhea and chlamydia. We can also schedule you to come back in for your implant birth control to be put in, and also we can do a pap smear and screen for HPV and cervical changes then too. Does that sound okay?
Sounds perfect.
Okay, Abby, so your pregnancy test came back negative.
Oh, perfect.
Good, is that the result you were looking for?
Yeah.
Good. Before you leave today, let's talk a little bit about safe sex more. The best way to prevent it is to abstain from sex. While birth control implant that you're getting is over 99% effective, it is important that you use a male condom to protect yourself against STDs. If you have any more questions at all, our website talks all about different kinds of birth control, and you can chat online with one of our educators there. You can also come in anytime you have questions as well. You can have your gynecological wellness checks here as well as your general physicals and vaccines. Are you interested in getting the HPV vaccine at all to help protect against certain kinds of HPV?
Yeah.
Okay, that'll be a 3-series shot, and we can schedule those here as well. All right, Abby, do you have any more questions?
No, I don't.
What are some things that we talked about today you think that you would be able to use to help you have a safer sex and prevent pregnancy?
I think next time I'll definitely use a condom and probably be more open with my partner.
Great. That sounds wonderful. All right, Abby. Well, good luck. Let us know if you have any questions. You can call us anytime.
Thank you.
All right. Have a great day.
You too.